If you suffer from acute or chronic pain, you need to get to the root of the issue in order to discover optimal wellness. And that's exactly what Physical Medicine Associates is all about.
Our goal is to really look at the body as a whole, because if you treat condition specific, it's a lot of times going to not really fix the root. So our goal is to take a look from head to toe and see what's going on with the person individually and create a plan that's going to be best to get them out of that chronic pain. We see a lot of neck pain, back pain, low back pain, sciatica, knee pain, and also headaches.
How do you know what treatment option is going to fit a patient, because it's not the same for everybody?
We meet as a team after we evaluate that patient and make sure that we're customizing a plan that's going to include the things that are going to be most beneficial for that patient. We have trigger point injections, large joint injection. We also have exercise therapy, chiropractic care, medical care, and now our headache protocol. We're seeing longer lasting results with the treatments that we do. And the other thing I like about our headache protocol is we're taking away a lot of the chemicals that are used in treating the typical migraine. So in using the trigger point injection as well as the sphenopalatine ganglion block, we're taking away a lot of the side effects as well as getting much longer lasting results.
We have a headache protocol that treats not only migraine headaches, but tension headaches, cluster headaches, post-traumatic headaches. And what that's called is the Spg Nerve Block. We inject a medicine that goes to the nerve, blocks the nerve that causes the headache. Over time, we will actually see relief from the headaches.
I was getting headaches probably 3 to 5 times a week, and they were quite severe. I was vomiting with them, having a hard time working. It's been 6 months since starting the headache protocol, and I've been virtually headache free. I would definitely recommend having the headache protocol to anybody who has migraine headaches.
It seems as though you have a lot of options when it comes to physical hands-on therapies, but you also have a medical side to your practice as well. What's that about?
So the medical side is incorporating a lot of things that are going to be holistic approach, from trigger points to large joint injection. We've also incorporated regenerative cell therapy, which is going to include PRP as well as stem cell, and we're getting really phenomenal results.
The trigger point injection is fairly simple, an injection with a very fine needle that helps break up the trigger point and relax it. The rapid release is a vibration gun used over top of the injection site to help enhance the effect of the trigger point injection. For some patients, we see relief even with the very first treatment.
I fell, dislocated my shoulder, and tore my rotator cuff. My workman's comp doc, after the MRI, told me that they couldn't do anything, just some PT, and I would get some range of motion, and this is all I got. My recommendations for my shoulder were trigger points and chiropractic. Now my range of motion is without pain.
PRP is platelet-rich plasma therapy. We draw your own blood, spin it down in a centrifuge, draw off the appropriate portion that stimulate your body to regenerate its own tissue. Then we inject the PRP back into the area that's being treated.
I have chronic knee pain for about 15 years. I had a hyperextended ACL and problems with my meniscus kept me from being able to walk and go up and down stairs and do activities with my kids. And Dr. Klein recommended I do the PRP therapy. I did 3 different treatments, and since then I've been able to walk and run and go up and down stairs and live my life like I want to. It was really important to me to be able to get off of pain meds and be able to get on with my life without having to go through surgery.
Stem cell therapy can be really controversial, so what's your answer to that?
Historically, when people are talking about stem cells, they're talking about embryonic stem cell. We actually do not use that in our office. What we use is amniotic stem cell, which does not have the controversy around it. And there are a lot of people who have questions about the stem cells that we're using. So what we actually do is we offer a free seminar.
You have very specifically chosen a chemical-free, surgery-free approach to this practice. Why is that so important to you?
So a lot of times when you use those chemicals or when you have surgery, you may find relief, but in the long run it can cause other problems. Our goal is to fix those things without causing those long-term effects.
Don't suffer with chronic pain. Visit Physical Medicine Associates for more information and a complete list of services. Go to physmedofgainesville.com.